Hi, this is Dr. Fischer from Fibroid Institute Houston, answering your most common questions about uterine fibroid embolization. One of the many more common questions that we get from patients is, why on earth do I need to do a pelvic MRI if I've already had a pelvic ultrasound? Well, the MRI provides much more detailed and important information than the pelvic ultrasound, specifically about the blood flow to the fibroids, how much blood supply there is, and oftentimes where it's coming from. This information may not be so important if you're having surgery or a hysterectomy, but it's extremely important for embolization because we're cutting off the blood supply to the fibroids. So it's important to know that information ahead of time. In addition to that, ultrasound is very user dependent. Depending on who's doing your scan, how they're turning the transducer, how they're measuring, they can get very different answers from scan to scan. So they can make the fibroids look a little bigger or a little smaller or a little different location. With MRI, we eliminate all of that human variation or variability. We know exactly how many fibroids you have, how big they are, where they're located, and what their blood supply is. And these are all very important factors in determining if embolization is right for a patient. In addition, there can be other ovarian pathologies that we need to know about before doing an embolization on a patient. In patients with enlarged uterus or fibroids, oftentimes it's difficult, if not impossible, to see the ovaries. And it's very important to make sure there are no abnormalities in the ovaries that may make surgery a better option for a patient. With MRI, we have a much better chance of seeing the ovaries and making sure that none of these things exist. Also, there is a condition known as uterine adenomyosis, a completely benign condition which oftentimes occurs with fibroids and can cause symptoms identical to fibroids, and it can be very difficult, if not impossible, to diagnose by ultrasound. The only reliable way to diagnose uterine adenomyosis is with an MRI, and it's important to have this information as well. So MRIs are an important part of the workup and evaluation of a patient for uterine fibroid embolization. I hope this helps. If you have any questions, please don't hesitate to contact us. Thank you.